Hello everyone and welcome to my YouTube channel. This is Dr. Naz and today I'll be discussing about pyogenic liver abscess. So it is an uncommon but important because it is curable, and if it's not treated then it's fatal. Infection reaches the liver through hepatic circulation or portal circulation. It can reach via biliary tree as well, either due to injury or direct spread from adjacent organ. Most common agent is E. coli or Streptococcus miller. So you have to remember this, that the most common causative agent of pyogenic liver abscess is E. coli or Streptococcus miller. Other causes are Streptococcus faecalis, bacteroids and Klebsiella pneumoniae. So these are the few differences between amoebic and pyogenic liver abscess. I have already discussed amoebic liver abscess in another YouTube video. You can go and check out. So in amoebic liver abscess, the organism will be Entamoeba histolytica, whereas in pyogenic it's going to be E. coli, Klebsiella pneumoniae or Streptococcus miller, etc. In amoebic liver abscess, there is mostly a single abscess, and in pyogenic there are multiple abscesses present. In amoebic abscess, there are no signs of toxicity, that is, there will be no such high grade fever. If there is fever, then it is going to be low grade or even no fever. However, in pyogenic liver abscess there will be high grade swinging fever. And in amoebic liver abscess, the secretions, the abscess is mostly chocolate colored. It is also known as anchovy sauce like cystic secretion. And in the pyogenic, it's yellow colored pussy discharge. However, in both, the liver is involved, therefore there will be increased liver enzymes. So the causes, most common cause is biliary disease, either ascending infection due to biliary obstruction or contagious spread from an empyema of gallbladder. Colonic disease can also cause it, example diverticulitis or Crohn disease. Other causes are pancreatitis, intra-abdominal sepsis or traumatic introduction of bacteria into the liver. So this picture is representing different routes from which bacteria enters the liver. For example, via bile ducts when there is a biliary disease, which is the most common cause, by the way, like in ascending infection due to biliary obstruction, that is gallstone, or there is any malignancy or a stricture, or direct contagious spread via empyema of gallbladder or traumatic introduction from hepatic veins and hepatic artery if there is bacteremia, via portal vein if there is any colonic disease like diverticulitis, Crohn disease, pancreatitis, intra-abdominal sepsis, non-metastatic colon cancer. So these all can cause entry of the E. coli or Streptococcus miller or any organism which causes pyogenic liver abscess into the liver, and it will result in abscess. Clinical features may include, as I have told you earlier, that there is going to be a high grade swinging fever with rigors and chill. There will be right upper quadrant pain which will radiate to right shoulder, and it is the most common symptom. There will be tender hepatomegaly, and because of the involvement of liver, there will be increased liver enzymes and it will lead to jaundice. So for the diagnosis, ultrasound is a great investigation. It visualizes more than 90% of the abscesses, and as you can see in the picture, there are multiple abscesses. Leukocytosis will occur as in any other infection. Plasma alkaline phosphatase will be raised because of liver involvement, and there will be hypoalbuminemia as well. Chest X-ray will show raised right diaphragm and lung collapse on the right side. It is because the liver is so enlarged that it displaces the diaphragm towards the lungs, or there will be effusion on the base of the lung. This is CT radiograph and it's showing multiple abscesses. So the treatment include combination of antibiotics, example ampicillin, gentamicin and metronidazole. Ultrasound guided drainage of abscess can be done if there is no response to medical therapy or if the abscess is very large. So that's the end of the lecture. If you learned anything, then like my video and subscribe to my YouTube channel. Thank you for watching.